Well, hello, everyone. Welcome back to another Women's Health webinar series. We are into part 10, and today we're going to be talking about sex hormone binding globulin, or SHBG. My name is Heaton, and I am the Women's Health Clinical Liaison. So today we're going to be defining what sex hormone binding globulin is. We're going to go through a brief overview of its role in binding hormones and affecting hormone bioavailability. We're going to discuss its relationship with testosterone and estradiol, its impact on thyroid function, the symptoms of high and low levels, as well as causes of high and low levels. We're going to discuss the clinical implications of high or low SHBG levels, its clinical relevance, and look at some ways to manage and balance SHBG levels. So, what is sex hormone binding globulin? It is a carrier protein produced by the liver that effectively helps shuttle around hormones in your body, such as sex hormones like testosterone, DHT, and estradiol. And it plays a crucial role in regulating the bioavailability of those sex hormones. So here are the normal reference ranges for males and females. And this hormone lives under the constraint of the Goldilocks phenomenon. So you don't want too high of a level or too low. And SHBG is considered suboptimal if it is lower than 60 nanomoles per liter. And the Goldilocks range, which is functional, is between 60 to 80 nanomoles per liter. So SHBG binds to sex hormones in the bloodstream, forming complexes that regulate the amount of free, unbound hormone available for use by cells throughout the body. And the binding of sex hormones to SHBG creates a reservoir of hormones in circulation. SHBG bound hormones are considered bound or inactive, whereas a small fraction of sex hormones remain unbound or free in their biologically active form. So it's the free fraction of sex hormones that is available to exert physiological effects in tissue, as they can freely pass through cell membranes and interact with hormone receptors. And by binding to sex hormones, SHBG can influence hormone levels, the distribution, metabolism, impacting various physiological processes that are related to reproduction, sexual development, and overall hormonal balance. Fluctuations in these levels can have significant implications for hormone activity and overall health. Now, the relationship between SHBG and testosterone. SHBG plays a crucial role in regulating testosterone levels in the bloodstream. It tends to bind tightly to testosterone, forming a complex that renders the hormone inactive and unable to exert its biological effects on target tissues. And this binding process creates a pool of testosterone that is bound to SHBG and unavailable for use, while a smaller fraction remains free and is biologically active. And when SHBG levels are elevated, more testosterone molecules are bound to SHBG, of course, reducing the amount of free testosterone available to interact with androgen receptors in cells. And this imbalance between free and bound testosterone can have various implications for health and well-being. So these low levels of free testosterone due to high SHBG can lead to symptoms of testosterone deficiency or hypogonadism. And some of those symptoms could be decreased libido, fatigue, mood changes, and reduced muscle mass. And in addition, low free testosterone levels may impact fertility in males and contribute to metabolic disturbances such as insulin resistance and obesity. SHBG also plays a role in regulating the bioavailability of estradiol. When SHBG levels are elevated, more estradiol molecules can become bound to SHBG, reducing the pool of free, biologically active estradiol in circulation. This binding process can impact the balance of estrogen signaling in tissues, and potentially affect various physiological functions regulated by estrogen. Estradiol levels vary from woman to woman, so the absolute value is not as important as the difference in the ratio between progesterone and estradiol. So high levels of estrogen can increase the amount of SHBG in the blood. So if SHBG levels are high, we want to check the estradiol to progesterone ratio mid-luteal phase of the menstrual cycle if she is still menstruating, and you want to look for the ratio that is 10-1 estrogen to progesterone, because high levels of estrogen can increase the amount of SHBG in the blood. And if SHBG levels are low, again, check the estradiol progesterone ratio after menopause, since estradiol levels drop after menopause, causing SHBG levels to drop. High levels of SHBG leading to decreased bioavailability of free estradiol may have implications for reproductive health, bone health, cardiovascular function, and other estrogen-dependent processes in the body. Changes in estradiol availability due to SHBG interactions may influence conditions such as osteoporosis, menstrual irregularities, and menopausal symptoms. Okay, so now let's look at SHBG's impact on thyroid. SHBG can bind to both T4 and T3 in the bloodstream, functioning as a transport protein that helps to carry these hormones to their target tissues. And when thyroid hormones are bound to SHBG, they're protected from rapid metabolism and degradation, prolonging their half-life and enhancing their circulation in the body. And similar to its interactions with sex hormones, SHBG also affects the bioavailability of thyroid hormones by modulating the levels of free or unbound T4 and T3 available for cellular uptake and biological activity. Higher levels of SHBG can lead to increased binding of thyroid hormones, potentially reducing the pool of free hormones and affecting their physiological effects. And changes in SHBG levels can influence thyroid hormone balance and function. For instance, altered SHBG concentrations may impact the binding capacity for thyroid hormones, potentially affecting thyroid hormone signaling pathways and metabolic regulation. Dysregulation of SHBG levels and its interactions with thyroid hormones have been implicated in thyroid disorders like hypo and hyperthyroidism, and monitoring SHBG levels alongside thyroid hormone measurements can provide insights into the hormonal dynamics and help assess thyroid function comprehensively. Now let's look at some key points on the impact of SHBG on thyroid. SHBG is a tool that can help evaluate thyroid function at the cellular level. And with up to 20% of the population suffering from subclinical hypothyroidism or overt hypothyroidism, this hormone imbalance is incredibly common. In states of low thyroid function, the SHBG tends to drop. And when thyroid hormone is replaced, SHBG tends to rise. And T3 tends to increase SHBG more so than T4 levels. But in some cases, taking T4 only thyroid medications like levothyroxine or Synthroid may not actually increase the SHBG level, and this could be a sign that the body's having difficulty with the conversion of T4 to T3 in peripheral tissues. The most common cause of suboptimal SHBG in a menstruating woman who has a normal cycle is low thyroid function. And it's very important to keep SHBG in the Goldilocks range of 60 to 8 nanomoles per liter. Elevated levels of SHBG can result in reduced bioavailability of sex hormones like testosterone and estrogen, leading to symptoms associated with hormonal imbalance. And some of those symptoms include decreased libido, lack of motivation, irregular periods, vaginal dryness, decreased bone mass, memory loss, fatigue, mood changes, and depression. Causes of high SHBG levels include liver disease, viruses like viral hepatitis, hyperthyroidism, eating disorders, oral contraceptive use in females, and in males, reduced production of sex hormones. Now, factors that may raise SHBG levels: physical exercise. There's been studies that have found that exercise was associated with higher SHBG levels. Higher BMI was associated with lower SHBG levels, however. A primary reason for SHBG levels to increase is from high cortisol levels, and high cortisol levels occur from both a short-term and long-term stress response of any type, whether it's physical or emotional. And the connection between SHBG and cortisol is a primary reason stress takes such a toll on hormone balance. Weight loss in multiple clinical trials have shown that SHBG levels increased after weight loss. Regular coffee intake was linked to increased blood SHBG in multiple studies, and medications such as synthetic sex hormones in oral contraceptives, anti-seizure medications, selective estrogen receptor modulators or SERMs, and metformin have all been shown to raise SHBG levels. So now let's go to symptoms of low SHBG levels. And some of those symptoms include excessive body hair or hirsutism or male pattern hair growth, acne, dandruff, baldness, voice deepening, increased muscle mass, reduced breast size, irregular or absent periods, enlargement of the clitoris, and weight gain. Some causes of low SHBG levels include high insulin levels, high growth hormone levels, high testosterone levels, non-alcoholic fatty liver disease, inflammation, and high sugar levels. Some conditions that are associated with low SHBG levels include type 2 diabetes, gestational diabetes, obesity and obesity-related conditions such as high blood pressure, high blood sugar levels, high triglycerides, low HDL levels, the good cholesterol, breast cancer. A meta-analysis of 9 studies found a link between low SHBG levels and increased risk of developing breast cancer, heart disease, high blood pressure, and polycystic ovary syndrome. Some clinical implications of high SHBG levels: it inhibits the bioavailability of sex hormones by binding tightly to them, like testosterone and estradiol, potentially leading to symptoms of hormone imbalance. It complicates hormonal assessments by masking the actual levels of free active hormones in the body, and influences the response to hormone replacement therapies, as high SHBG can reduce the effectiveness of exogenous hormone supplementation. Some other clinical implications of low SHBG levels: it can increase the levels of free active sex hormones in the bloodstream, and of course, potentially leading to symptoms of hormone excess or imbalance. It can impact the risk of hormone-related conditions like polycystic ovary syndrome or PCOS or male hypogonadism. And it can alter the pharmacokinetics of sex hormone medications, affecting dosing and treatment efficacy. Okay, so now let's look at the clinical relevance of SHBG in clinical practice. It has diagnostic value. SHBG levels serve as a very important biomarker in assessing sex hormone status and understanding hormonal imbalances. Monitoring SHBG levels can provide insights into the bioavailability of sex hormones like testosterone and estrogen. It also guides treatment. SHBG levels influence the distribution and availability of sex hormones in the body, impacting the response to hormone replacement therapies and other treatment interventions. And regular monitoring of SHBG levels can help in tailoring hormone therapy regimens to optimize efficacy and address hormonal imbalances effectively. It is also a predictive marker. So changes in SHBG levels can precede alterations in total and free sex hormone concentrations, making SHBG a potential early marker for hormonal dysregulation. Tracking SHBG levels over time can provide early indications of hormonal changes and guide preventive measures or adjustments in treatment approaches. So here we're going to discuss the impact of SHBG's role on treatment strategies for hormone-related conditions, such as hormone replacement therapy. Knowledge of SHBG's role in hormone binding and release can help with dosage adjustments and types of hormone therapies to account for variations in SHBG levels. And tailoring HRT based on SHBG status can optimize the delivery of bioavailable hormones and improve treatment outcomes in conditions like menopausal symptoms or androgen deficiency. And in fertility and reproductive health, understanding how SHBG affects hormone bioavailability can guide fertility treatments by addressing factors that influence conception and reproductive health. And SHBG levels can impact the balance of sex hormones crucial for ovulation, sperm production, and fertility, thereby informing clinical decisions in infertility management. So, understanding the importance of monitoring SHBG levels in clinical practice and recognizing how SHBG's role can impact treatment strategies for hormone-related conditions is fundamental to providing comprehensive care for patients with hormonal imbalances. And by integrating SHBG assessments into clinical decision-making, practitioners can tailor treatment approaches to optimize hormone balance and promote better health outcomes. And here are some treatment examples to either lower or raise SHBG levels. And some considerations would be supplementation of certain nutrients, for instance, to lower SHBG levels, omega-3 fatty acids, vitamin D3 levels have to be higher. DHEA supplementation can be good, resistance training, and correcting over-restriction of carbs and calories. And to raise levels, we've got flax seeds, soy isoflavones, green tea catechins, vitamin A and zinc need to be repleted, and chronic endurance exercise, correcting thyroid imbalances. So let's discuss ways to manage and balance SHBG levels. Lifestyle factors significantly influence SHBG levels, and making certain changes can help in its regulation. So some lifestyle modifications, you've got regular exercise, which can increase SHBG levels and thereby potentially reducing the bioavailability of sex hormones like testosterone. And this is beneficial in conditions associated with low SHBG levels like PCOS or obesity. Maintaining a healthy weight. Obesity is linked to lower SHBG levels, and weight loss, particularly when achieved through diet and exercise, can increase SHBG levels and improve hormonal balance. And weight management through diet and exercise can help improve insulin sensitivity and reduce adiposity, potentially raising SHBG levels in individuals with obesity or metabolic disorders. Stress management, chronic stress can impact hormone levels and indirectly affect SHBG. So meditation, Tai Chi, yoga, adequate sleep can all help in managing stress. Dietary recommendations, low glycemic index foods, which basically diets that are rich in high fiber. Foods that do not break down quickly in the bloodstream can improve insulin sensitivity and potentially increase SHBG levels. And this, of course, includes whole grains, legumes, nuts, fruits, and vegetables. Foods that contain phytoestrogens like soy products can increase SHBG levels, and they can particularly benefit women in managing hormonal imbalances. And moderate alcohol intake Too much alcohol consumption can decrease SHBG levels. So everything in moderation to maintain healthy levels of SHBG. Pharmacological interventions in cases where medication-induced reductions in SHBG levels are noted, alternative drug options or dose adjustments can be considered to mitigate the impact on SHBG concentrations. So specific medications like metformin or insulin sensitizers can be used to target insulin resistance and potentially restore SHBG levels in patients with hormone-related conditions. Hormone therapy optimization. So tailoring hormone replacement therapies to account for variations in SHBG levels can optimize the balance of bioavailable sex hormones and enhance treatment efficacy. And monitoring SHBG levels during hormone therapy and adjusting dosages based on individual SHBG status can help achieve better clinical outcomes in hormone-related conditions. So managing SHBG levels is not a one-size-fits-all approach, since managing these levels involves a multifaceted approach that includes lifestyle changes, dietary adjustments, and medical interventions when necessary. So understanding the factors that influence SHBG and how to modulate them can significantly impact an individual's hormonal health and ensuring overall well-being. Regular monitoring and personalized strategies are key to effectively managing SHBG levels. And regular monitoring through blood tests and adjusting lifestyle and treatment strategies as needed is important. Of course, this allows for a more personalized approach to maintaining optimal SHBG levels and hormonal balance. So, in conclusion, understanding the role of SHBG in sex hormone regulation, its potential impact on thyroid function, and the importance of assessing SHBG levels in hormone-related evaluations is essential for comprehensive hormone management. And by considering SHBG status in diagnostic assessments and treatment planning, practitioners can optimize therapeutic interventions and promote hormonal balance for improved patient care and outcomes. So connect with us. We are a national network of 503A and 503B compounding pharmacies providing innovative and quality pharmacy preparations and services through industry best patient care and solutions for practitioners and patients. We are here to assist with clinical questions, compounding ideas, and to provide top clinical resources for you and your patients for a fruitful health journey. Thank you for listening today, and see you next time for another informative webinar series.